For the latest COVID-19 news and updates, visit Hartford Healthcare's coronavirus website.
All right, good afternoon, everybody. Here with Josh and Paul, and two special guests who I think have a really unique perspective on what we're going through here with COVID. That's Dr. Saud Anwar and Dr. William Petit, who maybe you know are not only doctors, but they're also in our state legislature, and I'd love to hear their perspective on, from a doctor's point of view, what they're hearing from their constituents, what we're doing right, what we should be doing faster or slower, and other things as we try and work with the legislature through this. But first, let me just give you a brief update on what's going on over the last few days and what's going on in the last 24 hours. This chart is sort of reflective of where we've been for a while now. The death rate, blessedly, is slightly lower the last 5 days than it was the previous 5 days. Hospitalization is down. I think that's for 12 days in a row now. That's an important metric, as you've heard me describe before. Reason it's going down, as you can see from this next chart, is that Fairfield, Hartford, and New Haven are all on a downward trend. And the other counties have not really had a big uptick, thankfully, thanks to social distancing and taking that seriously, which we really appreciate. And again, the day-to-day change in hospitalizations, the 3-day moving average. This is why we have the reopening committee, and this is why we're focused on a prudent way we can reopen. What we're going to do is tomorrow you're going to hear from our Commissioner of Education, Miguel Cardona, and Beth Bai, talking about what we're doing in K through 12, what we're planning in terms of summer camps, so we can give you real guidance going forward now through the summer. Later on this week, you can hear from the university group that put in place a really good plan for how we can slowly get our universities, colleges, community colleges back up to speed. And of course, you'll hear from the Reopen Connecticut team probably on Thursday, as we've tried to do before. Just a brief overview. I just got out of our regular teleconference with the other governors and Vice President Pence and Dr. Birx and Dr. Fauci and the team that's leading the White House task force. I'd say, I was going to say better late than never, but that's not really where I'm coming from on this. Finally, the PPE is beginning to flow, and it's coming from the national stockpile. I think you see there'll be a big shipment going out to all of our nursing homes direct from the national stockpile over the course of the next week to 2 weeks. I think you'll see the testing, the reagents, the swabs, as well as the transport is all going to start going to the states based upon a need to be able to do about 2% of our population testing on a regular basis. That'd be 70,000. So that is beginning to roll out, which we're really appreciative of. You probably heard that we've joined with our other states from Massachusetts right down to Delaware, including New York and New Jersey, for a joint purchasing cooperative. And again, you may say, well, man, aren't we on the backside of this? Why do we have to do this now, just when things are beginning to flow? It's as if you're going to promise us delivery of the Christmas trees on December 26th. Aren't we over this? And the answer is no, we're not over this. And I think my fellow governors, the Republican and Democrat, are really smart. They're going to say, look, I'm glad we've got some flow coming from the federal government. I don't want to always have to wait to see if that plane lands from China. We're going to take this into our own account if we can. Let's see who has production capability, who has the pharmaceutical capability, who's got the swabs, who's got the agents. So us as a collective of 7 states can work on this in conjunction. We don't give up any of our freedom of movement, but it gives us a better base going forward to make sure we're never stuck in the situation we were 2 months ago. And look, hope for the best, plan for the worst. I'm not sure what's going to happen this fall. I've heard a lot of different predictions from the experts. That's why we're being cautious about reopening, and I want to be ready if there was another small surge later on this year. Some pretty good news, I think. You probably know that the federal government has been, pretty good, I think, when it comes to our small business and the PPP loans. And those are the loans that allow a small business to keep going for a couple of months, pays for all of their operating expenses, including salary. And we did well in the first round. In the second round, we did very well. Really thanks, I think, to our banks, our community banks, our electronic lenders like PayPal and the such. Obviously, DECD work closely with small business, minority-owned business, women-owned business to make sure they got in the front of the line. And we had over 30,000 Connecticut companies get a PPP forgivable loan in this round. That's $2.5 billion more to the state. This loan size is smaller than it was in the first round, but that also means more of our small businesses got access. And again, that's why we're focused on May 20th. We're focused on getting things reopened, just because we know that our small businesses just have enough firepower to get through over the course of the next couple of months, assuming they were eligible and got the PPP loans at all. One of the things I'd like to ask our doctors, Petit and Anwar, is some of the interesting things we're hearing coming out of the healthcare community and the medical community. Remdesivir, as you maybe heard, is a therapy that even it didn't come from the non-doctors on the White House task force. It came from Dr. Fauci and others that said, perhaps there is some therapeutic value there that would, mitigate, if not the risk, at least mitigate the amount of time you have to be in the hospital and perhaps save some lives, certainly save some times in the ICU unit. I'd love to hear what the doctors say about that. We're talking to a major Connecticut company just today. They're, again, being relatively optimistic on their trials for vaccine. It's a vaccine for folks under 55 and over 55. It's a vaccine they're experimenting in terms of different dosages right now. I'm not interested in the false hope business, but I am telling you the best of the information that I have coming in, and that's why we have two amazing doctors here on the phone. And I'll just leave you with this before I ask Saud Anwar to kick things off for a couple of minutes, and then Dr. Petit, and then we'll take your questions. Whatever you hear coming out of the healthcare community, whatever you hear in terms of therapies, whatever we hear in terms of vaccines, when and if they may come around, Dr. Birx was very clear at the end of our call today. She said these are all hopeful signs, but nothing is more effective and more tried and true than making sure you stay true to the important discipline and social distancing you need. Number one, hygiene, keeping your hands clean, disinfected on a regular basis. Two, don't be dismissive of the mask. This is Dr. Birx say this. Three, timing. Wonder about where you are as a state. I've got big Boston over there and New York down there. That's why we're a little more cautious before we ramp up. She was pointing to other states where maybe they opened a little too soon. Mississippi had to ramp back, briefly just because they saw a short spike. And crowding. Stay out of crowded situations as best you can. As you know, we had to close down our beaches after a certain amount of time this weekend, just because there was crowding at the beaches. We kept them open, but sometime around midday we had to do that. Dr. Birx said, if you only have to go to the grocery store once a week, that's a lot better than twice a week. And if everybody did that, that would reduce demand by 50%, and what a difference that makes. That's the advice we're getting from the White House task force. So with that, I see Dr. Anwar is on the screen, so let me ask him first. Just to say a couple of minutes, if you could, Saud, before I hand it over to Dr. Petit. Here you are, you're leading pulmonologist. You're also in our state senate. Give us some perspective on what you're hearing.
Sure. Thank you so much, Governor, for having me, and thank you for the hard work that you and your entire team has been doing. This is such an important time, and your leadership is so valuable, and it's helping save lives and then protect people. I'm in the intensive care unit, and I'm seeing unfortunately, the ugly face of the disease. This disease, by the time a patient gets into the intensive care unit, takes away their ability to exchange oxygen or blow off their carbon dioxide, and leads to multiple organ failure, including the lungs and the kidneys being the main organ, but the patients do get very, very sick. We are seeing heroic teamwork on the part of healthcare workers across our state. I cannot say enough things about the people who are putting themselves at risk at the greater good to take care of as many patients as we can. And that's the reason we have relatively good results in the state of Connecticut with the critically ill patients. Thankfully, as you have alluded to as well, that the number of new patients coming into the hospital has slowly started to decrease, but does not take away from the high amount of work that is required to take care of each and every patient who is critically ill. So that's part of what I'm seeing. Our ability to manage this disease is getting better because we are getting far more experienced in managing it, and then the scientific component is actually kicking in. We are putting a lot of pieces of the puzzle together to be able to manage this based on scientific criteria. I think the remdesivir gives a little bit of a hope because it does have antiviral impact, and it does actually help us get hopefully lesser hospital days. That's at least all we can say right now. The severity of illness may decrease. The challenge is we have not been able to access it as of right now. We were using it for compassionate basis for children, and I have no experience taking care of children in the ICU, and pregnant women were offered it for compassionate basis. But now with the FDA's nod, there's a good chance that the access is going to improve. So that's good, but the plasma is something that if we can get enough antibody testing in the community, and if we can get enough antibody testing, we are hoping that more and more people will be able to donate plasma that can be very effective and helpful in reducing the disease burden or the severity of disease in many patients. So if people who are listening to your leadership, Governor, if we can get more people to who have healed and who are improved, who are about a few weeks out, about maybe 28 days in some respects, we can actually give their plasma to help us save the life of somebody who's in the intensive care unit. I can say a couple of words about what I'm hearing in the community about the work. There is anxiety, there's palpable anxiety, which is all across the spectrum. One is the anxiety of getting sick, of being unwell, and then not having enough resources in the hospitals to take care of that. Thankfully, with the decrease in the number of cases, the hospitals are a little bit better placed than they were about a few weeks ago. But then there's financial anxiety that people are having as well, which is how are they going to be able to manage? How do they reopen the businesses? So there's a fear about resurgence and doing the right thing when they start the businesses, because the businesses would have to adapt according to prevention of disease in the customers, but also the workforce. So it's a very different way of looking at businesses, and then every single business will have to reassess how they have been doing things. But all in all, I think we are in the midst of a disaster. We forget that, and in the disaster, we are obviously stretched with our resources and capacity. The best way to do this is to actually work together in a collaborative way and try to have feedback mechanisms and systems to make sure we make the best decisions and continue to improve. And your team has been available to us literally almost every single day, and they hear my complaints all the time or concerns, and the feedback loop of them working towards addressing them has been very, very appreciated. And hopefully, while I know your vision is to have May 20th to be opening time, I'm a little bit concerned from a medical point of view for that, and hopefully we can talk about that aspect. And finally, I'm sorry I'm taking a longer time. There are concerns on the nursing home patients and the personnel in nursing homes with the personal protective equipment availability. If that improves, that would actually have more protection in place. And then those are some of the main areas that I wanted to touch on. And again, thank you for this opportunity.
Saud, thank you very much. Bill, I hope you could hear that.
I did, thank you. What I've been hearing is similar things to what Saud has heard.
Move your
You may want to raise your camera just a little bit.
Up and back a little bit.
Perfect.
Back at you a little bit more.
That's good enough.
Hearing many of the same things that Saud is hearing. There's a lot of concern. There was concern about capacity, which we seem to have met. When people ask, some people want to open up the state tomorrow, and I say, you have to understand that it's incredibly dangerous. The contagiousness factor, the so-called R0, is 2.5. But once you're out 10 people removed from an initial case, you can impact upwards of 10,000 people. In addition, though, many of the fatalities have been in the people over 60, 70 years old at times, and I'm sure Saud can attest to this. There's people in their 20s and 30s that come down with the disease and die within a couple of weeks. So we really don't understand the susceptibility and some of the genetic variations. As he noted, remdesivir may be helpful. It seems to have decreased the hospital days by 4 or 5. I would also note that it's important for people to know that many of the other drugs that have been mentioned, the hydroxychloroquines, chloroquine, other antiviral steroids, the Infectious Disease Society of America recommends it only be done under the auspice of trial, that because the data has not been very good with most of those other drugs. I hear some of the same financial issues, but what people are looking for from the Reopen Committee is very specific advice. In other words, if restaurants and nail salons are going to be open in 2 weeks, they want a specific list of things that they must do. And I'll give you a specific example. My public health director suggested that if there's going to have to be physical barriers in certain places, people need time to be able to obtain the raw materials and construct whatever physical barriers may be needed. The businesses need the time to be able to obtain the protective equipment, be it masks, gowns, gloves, sanitizing materials as well. If restaurants are going to be feeding people outside, they need time to set it up. They have to obtain tents and other facilities. And speaking with my health director, he was also concerned that we reinforce the basics, as you did, Governor. Masks still play a role. Not touching your face and sanitizing plays a big role. And if you're sick, you should stay home. There's people who are trying to gut it out sometimes and become ill and actually still show up at work. And if you are ill, have a fever, have a cough, you should not show up to work until you've been cleared by the medical system. So I think we can do what we're doing, that is begin to have plans to reopen, but have to do it cautiously so we don't see a resurgence of the disease. And I think what everybody out in the community needs is very specific guidelines so that they can follow those guidelines to minimize our risks.
Hey, no, thank you, Bill. Very well said. As you probably know, right now we're meeting with the Restaurant Association and the Retail Association, getting the very best ideas we can from those businesses themselves, what they think would be the appropriate protocols that could keep their employees and their customers safe. We'll be able to outline them in about a week, so then everybody would have at least a couple weeks to prepare accordingly for the opening of their business. No, well said.
NBC Connecticut.
Yes, thank you. For the doctors, Dr. Petter, Anwar, there's another rally happening today where people are protesting that the state should reopen immediately. Can you give your thoughts and your perspectives on this, not just lawmakers, as doctors?
Could you guys hear that question?
Yeah, I can take that if you don't mind. So again, it's quite disappointing, and then I'm going to speak as a doctor, but also more of an advocate for the patients as well as for my team members who are working and putting themselves at risk every single day, taking care of the patients who literally close to breathing the same air that the patients are breathing. Look, we cannot afford a resurgence. Using these tactics and using these scare tactics and things that they are trying to do are actually not smart way of doing it. We're in the midst of a pandemic. And in the midst of a pandemic, the responsible thing to do is to do it based on science and not emotion. There are patients dying every single day. Just because the number of deaths have decreased does not necessarily mean that we are safe. We still have to do the basics, things that we have alluded to. And if they are actually going to try to use these tactics to try and scare people, it's going to not be of any effect or benefit. My community, my nurses, my respiratory therapists, doctors, they will die from some of these bad choices they're making because they will end up seeing many more patients that we can handle. So please be responsible. Please do the right thing. This is not about using ways of agitating people and using political ways of trying to open the state by putting elderly, seniors, and all age groups at risk. So that's my message and my comment to them.
No, thank you, Saud. And Bill, you might want to comment as well. That's a better picture. That's good. Oh, lift up the camera just a bit if you can. I don't think I said that right. We got the lower half of your face. There you are. Oh.
What I said before, I think people have to understand the contagiousness of this disease. Again, many people, since there can be asymptomatic carriers, that creates an issue. Since people may shed virus for 2 weeks, even when they've been diagnosed, it puts many other people at risk. And again, we have people who are older, have comorbidities that are dying, but we also have people that are very healthy, not very many, but that are dying. And I think we don't want to take that risk. I think we can begin to slowly reopen, and that's why I think the important issue for government, for the Department of Public Health and the committee, is specific regulations. People who run small businesses are not experts in infection control, are not experts in virology, so they need very specific instructions as to how to sanitize, when to sanitize, distances, etc. That'll be very important information for people in the community so that they can be assured that they're doing the appropriate things, opening their business, earning a living again, and serving the public. So I think we can do it, but we need to do it with appropriate preparation.
Thank you.
Governor, as the warmer weather hits, I know unlike a lot of southern states, we haven't had snow or anything, but as that warmer weather hits, any changes as more people go outside, more people maybe coming up to Connecticut from states with restricted policies?
I think I got about half of that, Max. It was southern states and people going outside, and what are the best processes there? I'm sorry if I didn't get your entire question. I will tell you from all of our scientific committees that we've had as part of the reopening Connecticut, there have been some break points, inside versus outside. Outside, much safer. You'll see around the country that they're opening, for example, restaurants for outside first, seems to be a priority from Mississippi to Connecticut. You'll hear from the academic folks that, residence halls are more risky than the commuter campus. So we're thinking about what some of these break points are, and they help us figure out how to phase in a safe way to reopen.
Move on next to Channel 3 Eyewitness News.
Yes, this question is for Dr. Anwar. Doctor, when we see the daily hospitalizations in all counties on a decrease, we're anticipating that hospital capacity will not be tested. Why do you feel that May 20th is too early to reopen?
So I think the way I look at it is that the worst case scenarios are, or 5% of the population gets into the intensive care unit, about 15% are more in the hospital there. So all it's going to take is one nursing home with about 100 people that is overwhelmed the intensive care unit in the entire hospital. We have seen this in New Jersey. In a matter of 10 days, 100 people died just from one nursing home. We have seen similar situations with the 30 or 40 people from one facility get critically ill. This disease spreads like fire, and it it's going to take about 10 to 20 or 30 patients to overwhelm any hospital if they come. So when we are going to have increased interactions, we will not be able to take care of this. And the other thing is, look, this is in our generations, we have not seen this experiment pan out. It was 102 years ago when we actually saw this experiment or situation develop. The responsible thing, in my mind, would be to see what is happening by the policies in other states and other countries. And I think that's what the governor has alluded to in some of his interviews as well, is that we are watching what's happening. If the data is correct, because they're not even collecting the data in Florida very well right now, and also in Georgia, but those would be the states to watch and see how things are going to happen in the next 3 to 6 weeks' time. Because if the data is accurately collected, I am unfortunately anticipating a big resurgence of illness in that region, and I want to have the Connecticut people follow some scientific basis rather than an emotional need.
And Governor, after hearing that advice from doctors, you've coordinated with your own team on the state level and also on the national level, getting all of those opinions. How do we address some of those concerns that May 20th might be too early?
What we're going to know what we have by May 20th is we've got 3 weeks of experience, like Saud said, in places like Georgia. That gives us a little bit of an indication. We've got the necessary masks and protective gear, so if small business can't provide it for themselves, we'll be able to provide it for them. As Josh will tell you, we'll have greatly ramped up our testing, so I'll have a little early intel in terms of where some of those flare-ups could be. And to be blunt about it, if you find on May 27th that we've had some flare-ups and it looks like the nail salons are risky, we can always throttle it back, but I hope we don't have to do that.
Next to News 8.
Dr. Anwar or Dr. Petit, how strong is our medical system here in Connecticut? In Italy, we saw they had a lot of problems, it was bending. How are we doing here, and what's the health of our medical system?
I can start. I have a bias. I think if anybody has to get sick, this is the state to get sick in. God forbid. I don't want anybody to ever get sick, but we have the finest team of people. I know a lot of the intensive care unit doctors across the state. I know nurses across the state as well. And I can tell you we have the finest of the finest that are there. And they're getting overwhelmed. It's a volume issue, it's an involvement issue. But with respect to the capacity, we are better than most other places, if not all.
Bill?
Unmute.
You're on mute there. Yep.
I think our medical system has held up very well. I think the lessons for us are national and have to do with our business model. We've moved many pharmaceutical companies overseas. We've moved much of the personal protective equipment overseas, and that created issues for us. We need to begin to manufacture those products back in the United States. We also had hospitals that in terms of cash flow and facilities that were doing on-time ordering, so people didn't have significant amounts of this personal protective equipment on site in terms of cash flow management, the way people do things in the modern era. So we're going to have to make some changes in national strategic plans in terms of how we do manufacturing for both pharmaceuticals and protective equipment. And I'm sure the Connecticut Hospital Association is already beginning some of those discussions as how to try to improve this as it goes forward, should we have a second resurgence or a different pandemic down the line.
And what kind of shape are the frontline workers in?
We are tired. I have been living in quarantine for the past 6 weeks, essentially. And many of my fellow workers are, if they have vulnerable people in their homes, they are living in isolation and quarantine or in the intensive care unit or in the hospitals. And we have people who are getting sick as well. So that is going to be a relevant issue in making decisions going forward as well.
And that brings up the critical issue of mental health. I posted a few days ago, everybody probably read about the 49-year-old emergency room physician from New York who took care of many patients, developed COVID herself, and then unfortunately ended up committing suicide. When I read about that, I was just crushed. Here was a person who was given their very all to save the sickest of the sick and was so overwhelmed that she felt that she needed to get away from by committing suicide. So it's important for people to take the time to care for themselves mentally. If you have to get away from the news for a day or two, do so. To take the time to rest appropriately, to talk to people that are important in your life, if they're in your home or via video conferencing, and to reach out if you need help, because mental health becomes a critical issue for the people on the front lines, but also for the people who are at home, who have loved ones in nursing homes, loved ones in hospitals, and they can't get to them to speak to.
Move along next to the Associated Press.
Good afternoon. Governor, what can be done about financial pain happening in Eastern Connecticut? There's many cases, but there's pretty high unemployment here, especially due to the casinos closing. and the ripple effect that that has had?
I think the question was about Eastern Connecticut and the unemployment situation there. It's worth remembering while Eastern Connecticut has by far the lowest infection rate in the state, it also has an increasing infection rate and an increasing hospitalization rate, perhaps in part, Sue, just because of their proximity to Boston, which is why we don't want to do anything we can that promotes travel between our states. You know, so we take that to account. And when it comes to, hey, how about we just open up the restaurants in Willimantic without opening them up in Fairfield County? Again, we worry about the idea that people are be driving back and forth and perhaps taking a virus with them. So I think we're a small enough state. I think we can open on a statewide basis. That was the conclusion of our Reopen Connecticut task force. And we're going to get going on that within less than 3 weeks.
I'm sorry if I broke up or something. I was also wondering about what can be done economically for the eastern part of the state, even though there aren't as many cases. There's very high unemployment because of the casinos.
Well, outside of the PPE, keeping those small businesses going, we just did the bond authorization to get state pier going, beginning of launching of wind power as a major industry for the greater New London area. I think that's going to be a real energizer for this part of the state. I think there's great future there, and I think those are just some of the engines that are really going to keep things going. Look, COVID is obviously is a gut punch to all different regions of the state, but I think when it comes to Southeast Connecticut, Eastern Connecticut, this is a part of the state that's going to recover early.
And also, the AP has taken a look at how much the states are getting from the federal government when you look at it per positive COVID test. And Connecticut's getting about $47,000 per test, and Alaska's getting $3.4 million per test. And some of these states that are getting more than $1 million, they're spending this on non-medical purposes. I wonder what your reaction is to that. And are we getting enough to spend on non-medical things, or is it pretty much just going to be devoted to covering our COVID medical costs?
Yeah. No, that's a really good question, Sue. Right now, it's just COVID-related expenses with a little bit of help for, a couple other categories like testing. One of the problems is you got to go through the U.S. Senate, and in order to get those small states on board, even though they don't have very many people, they ask for a minimum. So you got Wyoming and Alaska, which have many fewer people than we do in Connecticut, but because of those minimum thresholds, they get a lot more per person than we do here. That's Washington.
Okay. Thank you very much.
Move along next to Fox 61.
Hello, good afternoon, everyone. Brian Dillick with Fox 61. Question to the governor real quick. This is a question from our viewers. For tattoo parlors being part of the May 20th reopening, from our understanding, they are not a part of the reopening, and if you can answer why or why not they are not a part of it at this time.
The question is, why didn't we open up tattoo parlors along with other things on May 20th? I think the advice I got from our committee, and I thought it was well taken, while a lot of people think it's great to do, it's not absolutely essential. It's very tough to socially distance. It created one more possibility of risk of potential contagion. Maybe let's see how it goes with the nail salons, and that'll give us a little more perspective for the next round of opening.
And my next question being for the doctors, when it comes to our restaurants reopening, some viewers have asked, would you all suggest allowing families to sit together, or could people from separate households also come together and enjoy a meal together when it comes to eating outdoors?
I personally would, if you're living together and have been throughout your quarantine time, I think it's fine to sit together. But at this point, I still wouldn't sit together with other families. I would maintain social distancing until we're farther along. Saud, thoughts on that?
Yeah, I agree with you, Bill. I think the challenge right now is that, look, people are asymptomatic, and we don't know the exposures of people who are not in our home and their risks, and that if too many people are sitting too close, the social distancing can negatively impact, and then you would subsequently get more people sick. So it's important to be safe, and then that's going to be important in this situation.
Thank you. And lastly, is there any guidance for dental offices? We've heard from many hygienists concerned about their safety in returning from work.
Yeah, I can try and address this. This is where it's very critical because of the dental hygiene and the work that involves. It's a high risk profession. So this would be one of the situations where you have to have the test negative patient and make sure the patient is negative, and have it available right at site if possible. And then subsequently, the person who's going to provide the care will need an N95 mask at minimum, with a subsequent shield covering them as well. And just like we are doing in the intensive care unit, have a complete protection with their hair, eyes, airways, all of this protected of the patient, and that environment also being only for that particular patient. Otherwise, the cough, the sneeze, the other aerosolized liquids would actually infect people around. So we have to have the right PPE, almost ICU level of PPE for that profession, in my opinion.
We'll move along next to the Hartford Courant.
Governor, today Governor Cuomo outlined a whole list of criteria, very specifically with different numbers that he wanted to hit before New York would open businesses. Do you have any plans to outline similarly specific criteria about exactly how much capacity we need, or how much different numbers need to drop in addition to that 14 days of decline, or are you following kind of similar metrics?
I think we're following similar metrics. To me, I'm looking at the infection rate. Obviously, we're looking at hospitalization in terms of our capacity there. As Saud said, that's very important. There's not much room for error. I'm looking at making sure we have the testing capacity in place so we can see flare-ups as they come over the radar screen, making sure I've got the masks that can keep people. That's all why we focused on May 20th, as well as giving our stores and businesses the opportunity to make sure their place is safe and ready to go based upon the parameters.
And so you've talked about testing capacity. You've talked a lot in the last few weeks about ramping up tests, and maybe testing has gone up a little bit, it looks like, but not quite as much as we need. Why has that been, and what gives you the confidence that over the next few weeks you will be able to ramp up testing to the level we need to get it to?
I'll start, and then maybe, Josh, you can help me out with this. We haven't sat around waiting for the federal government on this. So we've talked to the CEOs of all the major testing-related companies, be it CVS, be it Abbott Labs, be it Jackson Labs, be it our own people. Just a few days ago, I had the occasion to talk to the CEO of Thermo Fisher. Thermo Fisher is the biggest testing agent company in the country. It also happens to be where Josh Jabal once worked. So I'm using every relationship I can to get to the front of the line here. And we have strong assurances from partners like Thermo that we're going to have the testing agents we need to make sure that we can ramp up our testing in a way that gives you security that you're safe.
Yeah, I think one of the main reasons the volumes haven't ramped up more recently is there's been a significant shortage of the nasopharyngeal swabs that are required to take the samples. We have visibility to some significant shipments of the swabs coming into the state, and we also think we're very close to being able to start using saliva as a acceptable sample for the testing as well. We're also working to significantly scale up our laboratory capacity in parallel, so we're very optimistic that in the coming weeks we're going to see significant increase in our testing capacity.
Thanks, I appreciate it.
Move along next to CT News Junkie.
Thanks. This question is for the governor. Governor, with the hospitalizations being the only indicator right now that's going down, does Connecticut have to see a drop in the positive cases and the deaths too before the May 20th phase moves forward?
Those are less important metrics for me, Christine. I mean, fatalities are going down a little bit, but that's a lagging indicator. Obviously, the number of positives are a factor of how much testing we're doing. But to your bigger point, yeah, I'd probably look at the percentage of people being tested, especially when it comes to randomized testing. When we start testing more asymptomatic people, I'd like to see that as a number that's not accelerating but decelerating. So that's something else we would be looking at.
And also you said that the information with your reopening group that was shared on Thursday would be made public, but there doesn't seem to be anything released either on Advanced Connecticut website or the state website. And also, is there a comprehensive list of participants?
Yeah, I think you've got the list of everybody that was invited to join the advisory boards, because they're broken down of, education and higher education and business, and we'll get that re-released or back on our website if it's not there now, Paul. And in terms of other information, they'll be here on Thursday. You can ask them anything you'd like.
And are we going to see testing numbers go up today?
You know about that? Testing numbers going up today?
The governor showed the testing results at the beginning of the press conference. I'm not sure. We'll put out the usual test results today, as we always do, yeah.
No, I just wanted to know if they were going up.
You mean like posted on the website, as we do?
No. Like the number of tests that we're doing per day going up.
Yeah, they went up to about 2,800. I can't promise you that's going to be a straight line, Christine, because obviously it reflects a little bit of lumpiness, but I think you will see those consistently go up over the course of the next 2 weeks.
Thank you.
Move along next to the Day of New London.
Hello, this is a question for the governor. Governor, given that I guess the prospects are good, there'll be some kind of a special legislative session. I was wondering if you think it'd be feasible for the legislature to consider online gaming for the tribes at such a session. I know you didn't want to deal with that via an executive order, as was requested by a group earlier. I just wondered if you thought during a session there could be some action on that.
I think there are a couple of proposals swirling around. We'll see if it's appropriate to do in a short session like this. And it's the type of conversations we continue to have with both the Pequots and Mohegan.
Okay.
Move along next to the Waterbury Republican American.
Continue to have with both the Pequots and Mohegan.
Thanks, Max. I guess this is a question for Josh. What are the numbers at the Connecticut State Veterans Home and Hospital?
I'm sorry, Paul, you said the numbers at the Veterans Home?
Yes, the COVID, yes, the number of positive laboratory confirmed cases.
We can get back to you on that.
Okay. Governor, members of the legislators' conservative caucus have apparently, they've written Attorney General Barr raising concerns about some of your executive orders, your designation of essential versus essential businesses infringes on equal rights and property rights, the rental assistance program violates the contract clause, restrictions on firearm purchases, infringe on the Second Amendment, a couple other items. Have you seen this? Were you aware of this? Do you even care?
Well, I care. I mean, no, I haven't seen it. I haven't heard about it. And actually, nobody has brought it up to me in a series of conversations I've had over the last few weeks. So I'm a little surprised.
And with that said, Paul Mounds, Chief of Staff for the Governor, everything that the Governor has done within his executive powers is within the law and ensuring the public safety and health of the Connecticut residents and citizens during this COVID crisis.
Okay, but to the question earlier, the daily stats aren't up yet, so I'm wondering, if there was some issue with the transition yesterday? Just wondering what's happening with that. Just a housekeeping matter.
No, those numbers will be posted at shortly after the conclusion of this press conference. The Governor also showed the numbers at the beginning of the press conference.
Yes, I saw that. All right. Thank you.
No problem.
Thanks, Paul.
Move along next to the Connecticut Mirror.
My question is for the two doctors as well as the governor. The Secretary of State today talked about financial assistance that will be available for municipalities to help them prepare for the safe operation at the polls for voters and poll workers. She's going to send out absentee ballot applications, but under current law, there are relatively few people who can use those. So the question is, as a public health matter, do you favor allowing people to get an absentee ballot for reasons of avoiding public exposure to COVID-19?
Bill or Saud, you want to start with that?
Well, I guess.
Sure. Go ahead, Bill.
I personally would like to see if we could avoid the primaries and not have to tackle the issue until the general election in the fall, and we could reassess ahead of time and see where we are. I think it's too early to assess where we may be in terms of the general election. So if we can avoid having the primaries, but I guess if the primary is going to go on as scheduled, I think a lot of it will have to be done by absentee ballot if we continue with similar numbers.
So so my perspective is, from a public health point of view, this is a necessity. Look, in order for people to be able to participate, they should not have any fear to be part of their civic responsibility. Right now, people have fear of getting infected and subsequently being severely negatively impacted with their health if they were to go and vote. And I think for that very reason, it's critical that we have laws, whether I would prefer if it's a legislative action in the special session to increase the capacity to do mail-in ballots. And if we can do that, that would be the best thing. If for some reason the legislators do not meet, executive action would be reasonable in collaboration or coordination with all the four caucuses. That may be the way to approach this, but I think this is a very important issue, and then we have to address this to maximize participation.
Governor, you have not issued an executive order regarding the primary. You have indicated you would like to see some flexibility on the use of absentee ballots. You've also said you don't foresee having any authority over issuing an executive order in November because your order expires September 9th. So what is it you're going to do now as far as an executive order for the August primary and as far as asking the legislature to approve legislation that would address the November situation?
I think you asked the question and then you answered it very well. I'm with Saud and Bill on this. Assuming we're going to have a primary in August, because there's a primary for other reasons as well, maybe I address that through the executive order just to make sure people can vote safely, especially older people who we don't want, hanging around. And when it comes to November, I'd like to think that perhaps the legislature, working together with Paul and Bob, we come up with a good, fair way that they can pass some rulings that allow us to do the same thing for the general election. Subject to facts on the ground. Here we are in terms of the pandemic then.
Thank you.
Move along next to News 12 Connecticut.
Hi, Governor. Some of the restaurants are pushing for you to expand the rules surrounding delivery and takeout to include cocktails, mixed drinks. Right now, they're only allowed to sell pre-bottled hard liquor. A lot of other states are allowing cocktails. Any thought about doing that? What was the reason for excluding that in the first place?
Well, I'll take a look at it, but Paul is frowning at me, so go ahead.
I think I'm frowning because we actually didn't exclude it, and it's actually available in the state of Connecticut under the executive order passed by the governor.
So restaurants are free to sell,
sealed drinks,
cocktails made,
sealed,
yes, bottled up, and send them off in delivery.
Sealed. You talking about delivery or pickup?
Well, we'll ask for both.
We'll be happy to talk to you offline, but yes, that is currently happening in the state of Connecticut at this time for sealed drinks.
Okay. All right, great.
Rest easy.
Move along next to WTIC 1080 News.
Good afternoon. This one's probably for Paul and Josh. What are we hearing from state businesses, small business about the, well, now second week of the second round of the Paycheck Protection Program? Are they able to get through and get the help they need?
Actually, I'll nicely pass this over to the governor, who spoke about this at the beginning of his comments in terms of how well Connecticut did.
I think the answer to this is yes. I mean, let's face it, the first round was slow. There were some hiccups, and a lot of people filed and didn't hear back, and a lot of people didn't get it. In this round, I think it went a lot more smoothly. A bunch of big businesses didn't capture a disproportionate share. I think that was the right thing to do. And they did announce today at our meeting that there is still capacity in that loan program. So it's still not too late to go, and probably going to your local community bank or going to one of the electronic providers like PayPal seems to be a good route to go and get to the front of the line.
Commissioner David Lehman and Deputy Commissioner Gwendolyn Thames did an amazing job to make sure to get the word out to ensure that our small businesses in the state of Connecticut were ready and prepared once it went live online. And utilizing the various lenders, not only online, but also our banks here in person. I know Commissioner Lehman sent a note over to let us know that the state of Connecticut currently ranks 5th per capita in terms of the ability to get PPP in this most recent round. So I want to thank the small businesses in the state of Connecticut for really making sure that they're prepared for this second round, and thank DECD and all their partners for their work.
Great. And Mr. Governor, on the May 20th partial reopening, are you feeling a lot of pressure on that at all? Because you're getting it from both sides, and the latest projections suggest that what Ingenuity called the worst case scenario, which was opening and having to reclose, I mean, that could happen if some of the worst statistics that we're seeing follow through.
I'm not feeling any pressure. I've got some of the best scientific minds in the state who are advising us on what we can do when and how we can do it safely. 2 of them are with us today, by the way. And I am talking to the business community because we're very conscious. And the good news is the business community wants to open. They want to open safely, too. They want to open safely because they could not risk the idea that somebody gets infected at their store and what that means going forward for them. So surprising, there's an alignment of interest there, I find, between the business and the scientific folks in our discussions. Not always, but usually.
Thanks.
Hearst, Connecticut Media.
Hi, thanks, Max. Governor, in the meeting today with the White House people, is it becoming any clearer that the states might be able to get some budget funding in the next round? Is there going to be a next round? Is it still up in the air?
Look, in these meetings, everybody is always very positive, and the vice president is positive, and they say, I know that 90% of your budget deficit is related to the fact that revenues have collapsed, and I know we got to do something. Outside of the meetings, we get more mixed reports. I think we're going to get something. I think it's important, and I think the president on down wants us to get through this economic malaise, not just the healthcare malaise, and knows we won't get through it if states are forced to cut and slash. And it's not just blue states, it's red states as well. So I think there's a bipartisan commitment on the part of the governors to do the right thing here.
Josh, are you satisfied that the dental industry has access to proper PPE? Are you working with the association at all? Is it still too early, or what do you think?
Yeah, it's a little early. I mean, that's up to them to supply themselves. As you may know, we never close them by executive order, same with our hospitals and elective surgeries. So they're all assessing their own position right now in terms of the risk profile, as Dr. Anwar described earlier, their own supplies, the PPE capacity, and they'll have to make their judgments when they're ready.
And finally, Governor, I'm hoping you got a chance to go out on Saturday. It was a nice day. Lots of people not wearing masks. The Governor Cuomo was talking about how he was disappointed to some level today. I don't know. I know you don't want to put the foot on people's necks to do this, but how concerned are you about people ignoring the mask order?
Well, you heard from Dr. Bergs how important it is. Obviously, if you're outside and you can socially distance, I'm going to allow people to use their judgment. You're right, though. Our beaches were loved to death. Our parks were loved to death this weekend. We've been cooped up for a while, and people wanted to go outside. I think Katie Dykes, our commissioner, did the right thing. She said, look, we're going to cap the number of people who can park at our parks. We left them open, but we're only going to allow a certain number of people there to make it easier to social distance. I hope we got that balance right, but we'll watch it every week.
So it doesn't sound like you're in a position to talk about complaints from stores not enforcing masks or things like that.
I feel very strongly that when you're inside, in particular, inside a store, we have our safe store rules. That means employees wear the mask. That means customers wear the mask. I know that's disconcerting to a lot of people, but I think at this stage of the pandemic, that's really important. That's advice that comes from the very top. So we get a lot of notices. So we get notices from people that either they tell the store owner, hey, I don't think this is appropriate. Your employees aren't wearing a mask. And if they don't feel comfortable saying that, they let us know, and we have somebody there who tells that to the store owner.
Thanks, Governor.
Connecticut Public Media.
Thank you. Governor, you spoke last week about ramping up contact tracing in Connecticut in the coming weeks. I'm wondering if you could provide an update on where we are with that, and also an update on who is paying for this, if it's the federal government, the state, or local towns and cities.
Right now, my understanding is it will be a COVID-related expense. Whether that's a separate expense or comes out of that allocation we've already got, I'm still getting some direction on that. Right now, as you know, working through our public health departments all across the state, we have hundreds of volunteers who have already stepped up to do this. And Josh will tell me whether that's enough or we need other incentives for people.
Yeah, so far the team's very happy with the number of volunteers being identified, public health students, people with relevant training. But as the governor said, when as we go live, if we think that we're not covering all the contacts that need to be traced, we'll reevaluate and look to bring in additional staff or potentially additional volunteers. I hear all the time from people who want to help with this as a calling. But to answer your original question, the project is very much on track, and we're excited about having it well underway by the time we get to the May 20th date.
And Josh, does the state have any information on the reproductive rate of infection for COVID-19 in the state? Any information that would show us how many people on average one infected person might be spreading the virus to?
Yeah, I've seen many estimates published out there, and I talked to Dr. Carter, Dr. Coe. They all warn against reading too much into these. They all have different methodologies. It's a very hard thing to measure, as you're probably aware.
And so it's something that we would not track, or just what's the state's general opinion on that metric?
It's an important metric when you're building models, but to measure it empirically at any point in time is very difficult, and we don't try to do that in the state.
Okay,
all right, I think
thanks.
that's probably the last question. Let me just say to Dr. Anwar or Dr. Petit, we got plenty of lawyers here in this building. I like having more doctors in this building too. You guys did us justice. Thank you so much for what you said.
Thank you.
Take care, everybody.